Alright, good evening everyone. So what I will be discussing to you in this video is about the characteristics of persons with hearing impairment. Now the first characteristics that we have is cocks hand behind the ears, cocks ear or tilts head at an angle to catch sound. So this is what it looks like, ganyan. And tilts head at an angle to catch sound. So this is their way of catching sounds. Now another one is, for the second one is, has strained or blank facial expression when listening or talked to. Of course, kapag may kausap ka, tapos hindi mo masyadong naririnig yung sinasabi ng kausap mo or your teacher pag nagdi-discuss. So you would give them the facial expression that that shows kung ano yung nararamdaman mo. It's either you are confused. So ano ba ang itsura ng confusion when you're confused? You would go like this. Diba? Or just blank facial expression. Wala kang reaction. Kasi wala kang narinig, wala kang naiintindihan. Right? So for the third one is moves closer to speaker and watches face, especially the mouth and the lips of the speaker when talked to. Because in this way, they are trying to decipher or understand what the teacher is saying or discussing in the front. No, they are trying to understand the words by looking at the mouth of the speaker. Now for the fourth one is less responsive to noise, voice, music, and other sources of sounds. Yes, of course, magiging, they won't respond to any of these sources of sounds because wala silang naririnig. Now for the fifth one is uses more natural gestures, signs, and movements to express. Now, ano yung mga natural gestures? A simple hi or bye. Diba? Those are the natural gestures. How about the signs and movements? So this, the second picture here, this is the sign language. Now, if you are a teacher, especially if ang handle mo ay mga children with different disabilities, you have to learn this. No, these sign languages. Yan. Kasi this is their way of expressing their feelings. No? Alright, so yes. So the next one is often fails to respond to oral questions. Of course, yes, they will fail to respond to oral questions kasi hindi nila masyadong narinig. So hindi nila naintindihan. So this will make them not able to respond to questions. And the next one is often asks for repetition of questions and statements. So this is common in kindergarten and the elementary pupils. Diba? They would ask questions ng paulit-ulit kahit na kakasabi mo lang na, okay, everybody write the writings on the board, ganyan-ganyan, or erase the writings on the board or copy this on your notebook, and then mama bigla may magtatanong, teacher, isusulat? Diba? So that is one of the signs na may estudyante kang hindi niya narinig or naintindihan yung sinabi mo. Now, the next one is often unable to follow oral directions and instructions. Yes, because again, hindi nila naintindihan kasi hindi nila narinig yung directions and instructions na binigay mo sa kanila. And the next one is has difficulty in associating concrete with abstract ideas. Now, an example of this is a flag, for instance, no? Tapos, the flag represents the patriotism. Now, a person with hearing impairment, they are in difficulty understanding kung ano yung object, what does the object symbolizes. Yeah. And lastly, has poor general learning performance. So ito yung mga resulta, mga characteristics, mga gawain ng mga persons with hearing impairment. Ito yung mga nangyayari sa kanila. Now for the next one is the identification and assessment of children with hearing impairment. Okay, so the first one we have the audiological evaluation. Now, this is done by, of course, an audiologist through the use of sophisticated instruments and techniques. Now, the purpose of this evaluation is to determine the frequencies of sounds that a particular person hears. So we have here the audiology. Now, the meaning of audiology, this is the science of testing and evaluating hearing ability to detect and describe hearing impairments. And we have here the audiometer. This is an electronic device that generates sounds at different levels of frequency and intensity. So this is the audiometer. Ito, yan. So as you can see, pinasuot ang bata ng headphone. Now, ang naririnig ng bata dito is a sound, hindi siya music, but like boop, boop, pataas ng pataas. Depende, to test kung hanggang saan yung frequency na naririnig ng bata. So, ina-adjust yan ni audiologist. So, in that way, tinetest yung pandinig ng isang tao. Okay. So we have here the levels of decibels from 10 to 110 decibels. Now, ano ang decibels? Now, the decibels represents the volume and pitch. Now, the volume addresses the loudness of sounds, whereas the frequency addresses the intensity of sounds. And we have here the first chart, the green section. This is the normal hearing of an adult. So a person in this section may be able to hear birds chirping and rustling of leaves, and also the dripping, water dripping from a sink faucet. Now for the light blue, that represents the mild hearing loss, a person in this part naman, they may be able to hear loud whistles, depending on their ability to hear frequencies. No? But however, a person in this level won't be able to hear those items that we have mentioned, the green part. Okay. Now the third one is the yellow part, represents the moderate hearing loss. Now a person in this section may be able to hear the radio being played, but again, the person in this third chart won't be able to hear those items that we have mentioned. And for the orange part, the severe loss, a person in this level may be able to hear the lawnmowers, the dog's bark, a piano being played, and the ringing of a telephone. But they won't be able to hear those the three charts that we have mentioned. And finally, the lavender color, that represents the profound loss. No? A person in this level, this last part, may be able to hear the eight-wheeler truck, yan, the eight-wheeler truck, a chainsaw, a loud singing at a concert, a helicopter flying overhead, and a sound of a plane engine. But the person in this last part, sa last chart na to, they cannot or they won't be able to hear these items above mentioned. Alright, now as you can see, there is a shape of a banana, no? And between 30 decibels to 60 decibels, there are letters and sounds. Now this shows the level of hearing that is needed for most language communication. But again, depending on their ability to hear various frequencies. However, for the severe loss, those people with severe loss, a hearing loss rather, won't be able to hear these three charts above, as well as the profound loss. Alright, so that's for the this illustration. Right. So we have here the informal hearing tests. So we have letter A, whisper test. So this test naman is you ask the child or a person. For example, ako. No, tapos may tao sa likod ko. Iwi-whisper niya sa akin kung ano yung sinabi niya. It should be 2 or 3 syllables. So example of that, an example here, or rather, is the A24 or J6K. Now, the distance would be a few meters away, depende, or 1 meter. Now, while sinabi niya yung words na to, tinetest nito kung gaano kalayo yung ability ko na marinig yung word, yung sinabi ng isang tao. Kung kaya ko ba siyang madinig ng 2 meters, ng 3 meters, no? So that's for the whisper test. Now for the letter B, the conversational live voice test. So this is the normal interaction of two people, where you are going to ask yung kausap mo, yeah. You're going to ask them questions. You are testing their ability to how they understand what you are saying. Kung naririnig ka pa ba nila. Yeah, right. And for the ballpen click test. But this is a method used in audiology, yes, to evaluate the ability of children with hearing impairment to detect high frequency sounds. The ballpen click test, of course, lahat tayo, meron tayong ganyang ballpen. Pero yung sa akin, hindi ko dala eh. But, yeah. The ballpen click test, this test, as written here, ano? Sana tayo? Audiology to evaluate the ability of children with hearing impairment to detect high frequency sounds. Kung naririnig ba nila yon habang kiniklik mo yung ballpen, right? So that's for the ballpen click test. Now for the cognitive assessment. This is the assessment tools that measure intellectual capacity of children with hearing impairment and that they do not primarily rely on verbal abilities. Now, sinasabi lang sa part na to is that yung ability nila na marinig yung isang bagay does not mean na they're incapable of being knowledgeable about certain things. Hindi yun it does not define their ability to become knowledgeable at something. Yun yung sa cognitive assessment. Kasi ang tinitest lang naman kasi dito is their ability, yes, to hear, to think, their ability to make reasons, yeah, those things. Check dito yung kanilang cognition, diba? Oh. So number 3 is the assessment of communication abilities. Yes, this is to evaluate an individual's ability to effectively communicate their ideas, thoughts, and information through verbal, written, and or non-verbal means. So this may include verbal and written expression, problem solving, conflict resolution, and other skills. So tinitingnan dito yung kanilang communication skills. Yun ang yun ang nasa assessment of communication abilities. For the fourth one, the social and behavioral assessment. So this refers to the process of evaluating how hearing loss affects an individual's social interactions, behaviors, and overall psychological well-being. This type of assessment is crucial in understanding the broader impact of hearing impairment beyond just the auditory challenges. So, the characteristics that we have mentioned kanina, yun yung mga resulta ng mga actions ng mga persons with hearing impairments. So, as we have discussed kanina, no, naapektuhan talaga yung kanilang, as written here, an individual's ability to socialize, no, their behaviors as well. Kasi wala silang naririnig, so they are not giving any, they're not responding to it. They're incapable of answering questions dahil sa kanilang hearing loss, right? So that's for the social and behavioral assessment. Alright, so that's for my report. Thank you for listening. And I hope may natutunan kayo sa aking discussion. So thank you and wassalam.